And I apologize for the last minute rescheduling yesterday. I had a conflict that I didn't foresee. So I'll start with the data for today that is actually through yesterday, and then go into any questions that you may have. I think that one thing that is really important for us to recognize is that we've passed some really grim milestones in the last week. Across the country, we're approaching 800,000 deaths. Across the state, 15,000 deaths attributable to COVID-19. And in our own districts, we've passed 700 deaths associated with COVID-19. These are really grim statistics that remind us of how significant this pandemic continues to be. And we know, everybody is exhausted. People are angry that we're still in the situation that we're in, but it's really incumbent upon us as we move into the holiday season and these important family gatherings to do everything in our power to protect ourselves and our loved ones. So it is challenging, it is frustrating. We are all so tired of this, but the numbers don't lie, and this pandemic continues to have a devastating impact on beloved members of our community. So I just implore everybody to do what they can do to protect themselves and their loved ones, and to do what is most consistent with your family values. And hopefully that includes taking the precautions that you need to take to protect yourself and your loved ones. So if we look specifically at our data, I know I just provided the numbers. The data sheet will provide yesterday's numbers, just to keep it consistent on a Tuesday to Tuesday 7-day summary. So that number will be 696, but today, unfortunately, we are at 703 deaths associated with COVID-19. So if we look at last week's numbers, our new case count went up by almost 1,000, by 956 in the last week alone. Alleghany Health District, we have 25,568 cases. Roanoke City Health District, we have 13,409 cases. We continue to see the same trends that we've been seeing this past week. Approximately 20% of our cases are in children, so 18 and younger, and almost 50% of our cases are in people under the age of 35. So we know that this is our least vaccinated population, and we encourage everybody to make the best decisions for themselves, and hopefully that includes getting vaccinated. Certainly at this point, we recommend that anyone who's eligible for a booster get their booster shot. There are a lot of uncertainties, but what isn't uncertain is that these vaccines, while imperfect, are our best tool to prevent serious outcomes associated with COVID-19. With respect to our hospitalizations, not surprisingly, our hospitalization numbers are up as well. As of Monday, we had 87 individuals in the hospital. Of those, 63 were new hospitalizations. 32 of the 87 were from the Roanoke City Health District, 55 were from the Alleghany Health District. It is important to note that both our new cases and our hospitalizations are overwhelmingly in people who are not yet vaccinated. With respect to our vaccine distribution, we do continue to see some increase, although that increase has slowed down. We've now administered, with all of the vaccine partners that we have in our community, over 370,000 doses of vaccine. That includes boosters, and that includes children 5 to 11. And this week, I have provided a breakdown of the vaccination rates by age group per jurisdiction for anyone who's interested in that. And with that, I will open it up to questions. I do have a couple of other updates that I'd like to share with you. Actually, maybe I'll do that now before I open it up to questions. We do also continue to see more sporadic cases of hepatitis A than we typically see. These are not cases of hepatitis A associated with any food establishment. These are cases of hepatitis A that are predominantly associated with people who use injection drugs. And so we would really like to encourage anybody who is at risk for hepatitis A to go get their hepatitis A shots. Again, we're just seeing a slightly higher number of sporadic cases, so one-off cases of hepatitis A than we have typically seen, and we would like to encourage people to get hepatitis A vaccine if they would like to do so, and certainly if they're in a high risk group. And then finally, and I know that that it's a little bit overwhelming how much news we have, but Virginia now has widespread influenza, and we're continuing to see new cases of influenza as well. So anyone who has not yet gotten their flu shot, we certainly encourage you to get your flu shots. So hopefully we will be able to enjoy the holiday season as it comes upon us, but hopefully we will do so in a way that protects ourselves and our loved ones. And with that, I will open it up to any questions.
Hey, Dr. Morrow, how are you?
Hi, Ashley.
Hey, I just wanted to ask, I don't know if you have this information or not, but as far as hospitalizations go, we talk about increased cases and more hospitalizations. Do you guys have any information as to how many of the new hospitalizations, men and women, are vaccinated versus not vaccinated, what that percentage looks like?
Yes, if you hold on for just a minute, I can get you those data. We do continue to see, sorry, I'll pull up the specific data, that it is still significantly more people who are unvaccinated. We do need to be careful of any of our assumptions about that, just because as more people get vaccinated, that percentage may switch. But right now, for the 87, more than 70% of the people who are hospitalized are unvaccinated. And if we look at the age, the median age was 64.5%, and it's about 50-50 women to men ratio. I think that the one thing that's important to know is that given the age distribution that we have of people who are hospitalized, this is a highly vaccinated population. And so the fact that most of the people who are getting it means that from a representation standpoint, while it's 70% of people are unvaccinated, it's also important to remember that the denominators are different. So that really accentuates how effective the vaccine is at preventing hospitalizations, because we would expect that number, we would expect if the vaccine was not effective, given how many people in that age group are vaccinated, that number would be much, much higher. So I think that this is really good evidence that supports that the vaccine is effective at decreasing the serious serious sequelae of COVID-19 in people who are vaccinated. It really does decrease the hospitalizations and deaths associated with it if you're vaccinated, even if unfortunately you may get infected. Now, I also want to share that for the most recent data that were released, which represents cases through December 4th, people who are unvaccinated were over 9 times more likely to be infected than people who were vaccinated in Virginia. So that again speaks to, while this is not a perfect tool, it is a safe and effective tool at decreasing infection rates, decreasing hospitalizations, and decreasing deaths.
Pivoting just a little bit off of that, VDH has been pushing the Sears Vaccination Center, the old Sears, as a great place for every shot, whether it's first, second, or third. How have the numbers been there as far as getting people in the door, and specifically the 5 to 11 age population? What are the numbers looking like for the little kids?
So, our uptake in our youngest population is still not as high as we would like to see. Obviously, we would like to see it higher. The more people who are vaccinated, the more protected our community is. But so across all of our jurisdictions, about 25% of our children have been vaccinated in the 5 to 11 group. The CDC continues to vaccinate children, and I believe, I'd have to look at the numbers, that we vaccinated about 200 children in that age group in the last week or so. But let me double check that and we can add that to the data sheet. It's important to remember that the CBC has been such a wonderful gift to us in our community. And we also have pediatric providers and our pharmacies administering vaccine. So thankfully, we still saw about 7,000 more vaccines administered over the last week. The week before, we'd had about 15,000 vaccines administered in our community. So there are still people who are getting their children vaccinated with their first doses, and we certainly encourage that. And the numbers are speaking to the reality that there are people who are still interested in getting their first shot. So we're going to be there as long as we have people who are still interested. I hope that answers your question, Ashley.
It does. Thank you.
You're welcome. And I see that Jean has put a question in the chat. So one of the other statistics that is a grim reminder of the impact of this pandemic is that Virginia did hit 1 million cases of COVID-19. And we don't know yet what the Omicron variant is going to do with respect to our case count. We expect that it's going to impact us just as it has in other places of the country and in other places across the globe. So what does reflecting on 1 million cases, I think all of us were hopeful this time last year as the vaccine was introduced that we would be having a very different Christmas than we're having. The reality is that the vaccine has saved hundreds of thousands of lives across the country, and I'm really thankful that we have this tool. But this virus continues to out. It is a really challenging virus. We've been saying this all along, as long as there are significant levels of disease anywhere in the world, we risk mutations, and we've certainly seen that with Omicron. And I think that it's challenging that we're going into our second year of this terrible virus. The 1 million mark just shows what a profound impact this virus has had on us, not only with respect to the illness, the hospitalizations and the deaths, but how disruptive it has been on our economy, how disruptive it has been for our children, for our parents, for everybody. And so I think we just do continue to do everything that we can. We know community mitigation strategies work. We have almost 2 years of evidence that show community mitigation strategies work. We're tired of them. We are, but we have tools in our toolbox to, if not, this is not going to go away tomorrow. No matter what we do, this is not going to go away tomorrow, but we can blunt the impact by making smart choices for ourselves and our loved ones. And Jean, I'm not sure if you had, oh, yes, I'm sorry, Tom.
No, that's okay. I know we were expecting with cold weather, people being indoors and with holiday gatherings that we would see a increase in cases. Is it about the level we're expecting, or is it more? And what kind of concern does that give you for the Christmas holidays coming up?
The one thing that I'm loath to do right now is make projections. I'm the first to say I really thought we would be in a different place this year. And I was wrong. And I think it just speaks to the power of this virus and its ability to change. So I'm really hesitant to make any predictions. What I can speak to is that we are going up. We have almost 1,000 cases just in our jurisdiction this past week. I don't know what to say other than people need to be really smart and be really safe and works. And different people have different tolerance. Different people have different risk tolerance and different tolerance for accepting mitigation strategies. And all I can say is this virus has proven itself over and over. It has proven itself to be a deadly virus that is just caused much damage to our families. And so we need to respect that and do what we know works.
Hi, Dr. Morrow. It's Annie from Channel 10. I hope you're having a nice holiday season and thanks for all you do. Just a quick question. So obviously, President Biden's deadline for private companies and the vaccine mandate's kind of looming in the future right now. But are you guys, regardless of that, are you guys seeing any interest from like local businesses, or are you working with them at all to like, continue to get their employees vaccinated just in case that does end up happening? Or, are you guys still seeing an interest in testing from them, things along those lines?
So I think one thing for sure is that we continue to work with anyone who is interested in increasing access to vaccines, whether it's through our pop-up clinics or whether it's through precision clinics. So we're fortunate that we have some pharmacies that are also helping. We have our CVC, so we have heard of some businesses facilitating getting their employees tested through the CVC. And I think the bottom line is that we're willing to work with anybody to increase vaccination rates because we know that this is the best tool we have. Again, it's not a perfect tool, but it is the best tool that we have. And so it's really important for us to work with anybody who's interested. Thankfully, there are so many resources now that a lot of businesses are just encouraging their employees to go to the places that are already convenient, whether it's pharmacies, whether it's their doctor's offices, or whether it's our CVC. So my bottom line is, if anyone out there, if any business out there has any questions and wants to work with us to increase their vaccination rates, let us know, reach out to us. Christy can be a point of contact. But also, we have so many community resources, so don't hesitate to use those community resources. And again, the bottom line is anyone that like us to help them, and that includes business.
Thank you.
Hi, Dr. Morrow. It's Leanna with WDBJ7. How are you?
Okay, thank you. I wish I had better news for all of you.
I know. We do have some questions from folks in our live stream. Anna wanted to know if you have an update for the timeline for the under 5-year-old vaccine approval. She wanted to know the status of that.
I really don't have a timeline. I know I've said this before, that we just need to be patient as we allow the clinical trials to progress, and as we allow our processes that ensure that we have safe, effective vaccines to unfold. So we need to have the manufacturers do their safety and effective studies, and then we need to make sure that the FDA and the CDC weigh in and look at that evidence. So unfortunately, I wish I had an answer, but I don't have an answer on that timeline right now. I'm sorry.
We had another question from somebody after you had mentioned seeing some of those hepatitis A cases pop up primarily from injection drug use, and they wanted to know if you could talk a little bit about the symptoms of hepatitis A.
Sure. So hepatitis means inflammation of the liver. That's what the word means. And so people who have an inflamed liver, whether it's from a virus or whether it's from another cause, typically have jaundice, abdominal pain, frequently pretty significant nausea, weight loss, and then diarrhea, dark urine, and clay-colored stool are some of the classic symptoms for people who have hepatitis. And certainly anyone who has hepatitis associated with a virus, Hep A in this particular situation, have those same symptoms.
Thank you for that. We had another question from somebody who was wondering if you could explain for them what makes Omicron different, what we know so far about Omicron, and what makes it different than the variants that have come before it.
Sure, and I think that it's really important, and I know you just prefaced this, is what we know so far. This is we just learned about this newest variant very recently, and so it's really important for us to allow the data to inform us so that we can get more knowledge about it. So we're still very early on in understanding Omicron and what impact it will have. What we know so far is that this particular variant has a lot more mutations than some of the other variants, which means that with different mutations, different mutations can impact how contagious it is, how transmissible it is. It can impact how severe it is. It can impact how good this variant is at what we call evading the immune responses. And because this variant has so many more mutations than we've seen in previous variants, there's still a lot to be determined. What we know so far is that it appears to be more transmissible, meaning that so with the original strain, we were worried that if one person had it, they might infect two people. And of course, if we have community mitigation strategies, that changes the game. Delta was more transmissible. Omicron appears to be even more transmissible. On the other hand, so far, and I cannot stress enough that this information is evolving all the time, so we do not know at this time. It's just too new of a variant for us to know. At this point, it appears that it may have less significant symptoms, so it might be a little bit less severe. It also appears to be evading some of the immune responses. So we don't know exactly how that's going to play out. So people who have had natural infection do not seem to have any significant protection. And again, I have to be very careful. This is constantly emerging. What also appears at this point is that people who have had booster shots, that there is protection against people who have had booster shots, particularly against severe disease. So if we have to put it in a nutshell, there's still so much that we need to learn. At first blush, it appears to be more transmissible and hopefully less severe, but we still need to learn a lot more because we just have so little experience with this variant. So I hope that helps.
Thanks, Dr. Morrow. And I think the point about the boosters and what we're seeing out of them so far is a question that a lot of people have. And on that topic, my last question for you, coming from our chat, is continued booster eligibility. Shane wanted to know, when would he be able to get a booster for his 15-year-old? It's been over 6 months since his 15-year-old had his second shot. Can you talk to us a little bit more about boosters and eligibility at this point?
Yeah, so unfortunately, we don't have a booster. 15-year-olds are not yet eligible. Our 16 and 17-year-olds are now eligible, of course, and that's only going to be Pfizer. And then anybody above the age of 18, so 16 and 17-year-olds, if they've had their Pfizer, they're eligible if it's been 6 months for their booster shot for Pfizer. For 18-year-olds, regardless of what type of vaccine you've had, you're eligible for a booster, and we can interchange those vaccines. So hopefully we'll hear about our 12 to 15-year-olds pretty soon, but again, I don't have a time for that either.
Thank you, Dr. Morrow.
Absolutely. And for people who, I think that it is important to remind everyone that, absolutely vaccines are our best tool. 100%, they're the best tool that we have. We have so much evidence to support that. Our other community mitigation strategies are also effective when we implement them appropriately. So for people who are concerned because they are not yet eligible for their booster shots, I really encourage them to empower their family members and say, you know what, I'm not comfortable being around people who are not vaccinated. If we are going to get together, let's make sure we wear our masks indoors. Let's make sure we try to stay as a minimum 6 feet apart. We know that those strategies work. We have so much evidence that supports that those strategies work. And that's why we've been talking for a year and a half now, why it's so important to have a layered mitigation approach. Use all of those layers to really, the vaccines, the physical distancing, the masking, the hand washing, use all of those to minimize your risk and to protect you and your loved ones, to protect yourself and your loved ones.
A reporter sent me a question. They were having trouble getting in. That they have said, Virginia is experiencing a surge in flu cases, according to the CDC. Can you advise whether doctors are generally advising to test for both COVID and flu?
Yeah, so I think that a lot of places now are doing both. And I certainly think that it is very reasonable. If someone has flu-like symptoms, they should get tested for both. You know, we just learned a colleague of ours who had flu-like symptoms and was concerned that perhaps they'd been exposed to COVID, and it turned out to be influenza. And so it's really important. This time of year, we just don't know what it is. As I'd mentioned earlier, we are in widespread flu activity right now. And so I think that most places are going to test for both. And you can certainly feel empowered and ask to get tested for both if you unfortunately develop signs or symptoms. It's too difficult to tell just by the symptoms what you have. So testing is worthwhile. I will tell you, there are other respiratory viruses going around. And so a lot of places have the ability to test for multiple respiratory viruses, not just influenza and COVID-19. And so we're gonna see other things like RSV. There's so many other illnesses. But bottom line, I think that a lot of places are doing dual testing because we do need to know the difference between influenza and COVID-19. So thank you for that question.
All right. Well, thank you everyone for joining us. As I mentioned, we will get data out next week, but today I'll get this video and data out to you. If you have any questions, please let me know. Have a happy holiday.
Thank you, everyone.